Ever wondered how intravenous therapy works? How do those tiny droplets in an IV bag help save lives, alleviate pain, and deliver essential nutrients straight into a patient's bloodstream? Well, today we'll unravel the mysteries of this common yet complex medical procedure. Intravenous therapy, popularly known as IV therapy, is a fundamental procedure in healthcare. It involves the administration of fluids, medication, or nutrients directly into a patient's vein. Now, this might sound simple, but trust me, there's more to it than meets the eye. The first step is prepping the patient. This involves explaining the procedure to the patient to ensure they understand what's going to happen. It's essential to maintain clear and open communication to help alleviate any fears or anxieties the patient may have. Next, we move on to the vein selection phase. The healthcare professional must choose an appropriate vein for the IV insertion. They typically look for veins that are large, straight, and visible. The forearm is often the first choice, but other sites, such as the back of the hand or inside the elbow, may also be used. Once the vein has been selected, it's time for the skin preparation step. The skin around the insertion site is cleaned with an antiseptic solution to prevent infection. This is a crucial step as it helps to minimize the risk of germs entering the bloodstream. Following skin preparation, we come to the cannulation step. This involves inserting a cannula, a thin tube, into the chosen vein. A needle is used to pierce the skin and vein, after which the cannula is threaded over the needle into the vein. The needle is then removed, leaving the cannula in place. The next stage is securing the cannula. The cannula needs to be secured with a sterile dressing to ensure it stays in place and to further protect the site from infection. Now it's time for the fluid administration phase. The IV bag, containing the fluid to be administered, is connected to the cannula via a drip system. The flow rate is then set to control how quickly the fluid enters the patient's bloodstream. And finally, we reach the monitoring and removal stage. The healthcare professional needs to closely monitor the patient and the IV system for any signs of complications, such as infection or infiltration. Once the therapy is complete, or if any complications arise, the cannula is carefully removed. So to recap, intravenous therapy is a multi-step process that involves prepping the patient, selecting the vein, prepping the skin, inserting and securing the cannula, administering the fluid, and monitoring the patient. Each step is crucial to ensure the safety and effectiveness of the treatment. Remember, while this might seem like a routine procedure, it requires skill, knowledge, and attention to detail. After all, it's not just about getting fluid into a vein, it's about providing the best possible care for the patient. Thanks for tuning in, and stay curious, my friends.